I joined the NHS in 1991 in Oxford, and I was really lucky. I didn't know what I was joining at the time, it was just a job. But my first boss was on the National Executive of NALGO, which was a big union at the time. And she said, you need to love the NHS to work in the NHS, so you need to go away and learn about it. And so I learned there and then about the principles, the founding principles of the NHS, and the importance of being free at the point of delivery, and the values of universal healthcare. Well, we all love the NHS, but that means that we're all dependent on it, and it's a publicly funded service, it's a tax-based service. And we're living longer, we're demanding more of it, and it is becoming more expensive as new technologies, new drugs and new ways of working are found.
Having a sort of front row seat really to all that goes on for our patients and clients over the last 28 years in total has given me the view that we really do need to change. Things are not set up well for sort of joined up care of our patients.
We know that we have a population that's getting older. We know that we have a population that's getting larger. We know all these things mean that there is an increased risk of illness. We need to change from our reactive and regressive health system. So in other words, people contact the doctor when they're ill, not when they're well.
The payment mechanism doesn't incentivise a focus on outcomes, it incentivises activity and outputs. For example, if you have a hip replacement, we could be paying anywhere between £6,000 and £10,000 because you have the surgery. But it doesn't necessarily mean that we know that your surgery was effective.
Organisations can be focused in terms of delivering their own goals and objectives, and probably what we haven't been able to achieve is actually looking at the population, the whole population, and vulnerable people as well, and thinking about what their needs are, and actually building the organisations, building the care around those.
What we need is a system where there's much more of a team-based approach to things, where there's a sort of shared care for a particular patient or client, so that we all agree that the best place is to try and keep people in their home or at best in the community, and not to be sort of parcelling the person off to another organisation.
If we don't change the way we work, we're going to have a shortfall of around £200 million per annum in the next 3 to 4 years.
So we need to change. We have got to a point where the system is so fragmented, it is no longer delivering the high quality care that it would have done 20 years ago. We are doing more, we have to do more, but we have to do more with the same funding that we have in order for the system to be free at the point of use, which is where the great strength of the National Health Service is.
Accountable care means to me that I, as a member of the public, will be working with one organisation that's going to deliver all of the support and early intervention to keep me well and make me better if I become unwell.